This exercise is known as supine groin progressive in tower, or the tower for short. Now, before you get in position, you're going to want to take the foot pedal that came with your tower and place it on the foot that's going to be in the tower. So in this case, we'll put on Ani's right foot. Now, when I put this on myself or others, I always like to do what I call the double cinch method. So I put it on, I adjust the heel cup in the back, and then cinch it again, just to make sure the foot's in there good and tight and it's not sliding around, okay? Next, we're going to lift the legs up. We're going to set the left leg on the bench, chair, or ottoman that you're using, and the right leg is going to go out straight, right there in the tower. We're going to move the tower over so that the ankle, knee, hip, and shoulder are lined up on both sides. Now, the chair or ottoman or bench that you're using should be high enough that you get this 90-degree angle here at the knee joint. So, you know, for Anya, for me, for most people, 18 inches is going to be a good height. But if you're taller, you may want to take some pillows, a folded up towel or comforter, and place it under here to get the lower leg a little higher and the knee at that 90-degree angle. Okay? As far as your upper body, your arm is just going to be out anywhere between 90 and 45 degrees with the palms up. Okay? So you're always going to start in this upper, the highest position here, and you're going to stay here for about 5 minutes or until your lower back drops. So even if your lower back is flat, I want you still to stay here for 5 minutes before moving on to the next level. But if after 5 minutes your lower back hasn't completely flattened to the ground, I want you to stay here at least another 1, 2, 3 minutes, or however long it takes really, until that lower back drops. And you should be able to tell that it's dropped. If you're not sure, what you can do is push the lower back to the floor. So use your abdominal muscles, kind of do a pelvic tilt and push it flat. Then relax those muscles and see if the lower back pops up any. If it does, you want to stay here on this level. But if it stays relatively flat or all the way flat, then it's time to move down a level. So we'll bring the leg up and go down. Good. Now, a lot of people who get the tower ask, you know, there's 2 slots for the pegs to go in. There's 2 in the back and then 2 in the front. Which one should you use? I always tell people stick with the 2 back ones, unless for some reason I tell you to use the front ones or a mixture of them. Okay, so just stick to the back ones. Keep it easy. Now, as far as where you should feel this, you know, everybody's a little different. Some people say, you know, they don't really feel much. It's just relaxing. It feels good. Other people say they may feel it in the knee or the hip or the back or the shoulders. My response is that you're always going to feel this wherever you need it the most. So wherever you're the most bound up and tight, that's where you're going to feel it. And you know, you may feel a little achy or sore in certain joints, and quite frankly that's to be expected, especially the first few times that you do this. But if you're consistent with this, as the days and the weeks and the months go by, you're going to feel that less and less as those muscles release and go back to their normal length and tension, and it's going to get more and more comfortable. Which kind of leads us to, what does this exercise do and why do you have to spend so much time in it? Because if you looked on your routine instructions already, you've probably seen you're going to be here for at least half an hour per side, if not more. And the reason you have to be here, stay in this position for so long, is because what this exercise is doing is helping elongate the hip and groin muscles with an emphasis here on the hip flexor, otherwise known as the psoas. And as those hip and groin muscles relax, there's this chain reaction in your muscles that occur that cause changes in your upper body and your lower body. So there's a lot going on here from, you know, it's helping extend your upper back and your shoulders. It's helping reposition all your load-bearing joints, your shoulders, hips, knees, and ankles, as well as your head over your shoulders. In the lower body, it's helping remove any rotation in your upper and or lower leg. If you ever have any flexion, like some bend in the knee, obviously let it hang here. It's not going to hyperextend. In over 6 years, I've never seen anybody hyperextend their knee, but it may feel like the back knee is being pulled or stretched, It's just simply maybe going from that flex position you walk around with to that straightened position, okay? As well as the leg progresses down, you know, lower and lower and lower, you're getting more separation in your pelvis, because this leg is stationary, it's just relaxed, and it's at a 90-degree angle. Well, as you bring this all the way towards the floor, which would be about 180 degrees, you've now created quite a bit of separation in the pelvis, and what that does is it allows you to walk how you originally designed, which is if you kind of use a pair of scissors and how they open and close and the blades go straight forward and straight back, that's how we're designed to walk. But what happens if the hip and groin muscles are tight, the inner and outer thighs start taking over that function, and your hips start to swivel or you start to limp, and that can lead to knee, hip, back pain, and other various symptoms. Okay? So as far as common mistakes I see people doing here is that they just try to do something. Maybe they hold their thigh tight, they try to turn their leg in and out, they try to hold this foot in some position, they try to keep the lower back flat, squeeze their shoulder blades together, any and or all those, and they would all be wrong. So I always tell people, if you're trying to do anything in this position, you're automatically doing the exercise wrong. So the less you do here, the more you're going to get out of it. But if you're someone who really needs something to do, I'll give you something to do. We call it east to west breathing. So what I want you to do is inhale and exhale just through your nose, so just nose breathing. And when you inhale, you should feel your side here expand out like a balloon inflating with air. So when Anya inhales, I can feel her side press out against my hand, and when she exhales, it sinks or shrinks back towards the midline of her body. You should be able to feel that too in your lower back. What that type of breathing is doing is encouraging the movement of the diaphragm, which is your main breathing muscle, and that ties into your lower back, your pelvic floor, as well as those hip flexors that we're trying to elongate and relax. So that type of breathing will help facilitate the changes we're trying to make in this exercise. Okay? So again, do as many levels or as much time as it calls for on your routine, and then you would switch sides and repeat the exact same thing on the other side. Okay? And then go and move on to your next exercise if you have one after this.